Dr. Emilio, thank you so much for your time today. It's really great to see you as always.
A pleasure. Thank you for inviting me.
Your mindset is so inspiring, honestly.
Thank you. We started the journey like 3 years before coming here. I was the point because I was when I saw that we weren't getting through the everything. So and I was working with my public hospital. That was my main job there. And then I have also had private practice in Spain. So I was getting to a point that I was at 8 in the morning at the hospital, and I returned home at 9 in the evening because of my private practice. And I was practically like that 5 days a week. And then I started my process. 4 years it took for me for my PhD to finish because of COVID pandemic. It was got to stop there for all my studies. So I had like 2 years of not doing anything, but I still managed to continue because I didn't want it to leave there. Like I told you, if opportunity knocks, I think I have to push through.
Yes.
And I did that. And also two of my mentors over there, that was my last head of department, Dr. Belen and Dr. Pilar, they told me, oh, you have to continue, you need to do this. And I was like, but it's been 2 years, I don't know. And they encouraged me to continue. My wife also told me, you have started that, you finish it. So I tried to do that part, and was in that scenario. I started the process for to come in here. So I had those processes, the exams from here, the PhD. So I was placed. I was very busy, and I was also very stressed out with all of that points. And then we talked. I was very calm in that scenario because I thought this was going to come, and I was in a very good place in that moment also. So I wasn't desperate, and and a point that to tell I don't know what to do. And it wasn't okay. I'm good where I am. I know I can be better.
Yeah.
Still, I wasn't that. My kids were happy. My daughter, my wife also, and in Spain. But it will get to a point that I was a little bit stressed out for everything.
Yeah.
And I finished my PhD. The situation in Spain started to be a little bit more difficult, politically speaking, economically. The job offerings there, the stability was going through a phase like that. It's like that for the past years to come, but the last year was a little bit difficult, especially my hospital, my specialty, and things like that. So I finished my PhD. We started the process also there to stabilization in the hospital, and it was a very moment of we didn't know what was going to come next. And in that moment, I received a call from Abu Dhabi, an hospital from Abu Dhabi. I remember it perfectly because I was 6 a.m. going to my car to go to the hospital, and I received a long +9 telephone number. It was like, hello, and they said, yeah, we're calling you from here in Abu Dhabi hospital. We were looking for an allergy. We were like, okay. So my wife, someone has called me from there. Then we started process with them, and then after that, a couple of weeks later, I received another call on their +971. And it was like, this is Dubai area code. So my wife and another hospital told me, hey, I was looking at your profile and CV, and I was interested in an interview. So I started during that moment of uncertainty. I started the process from the interviews and everything with them, and I was like, then my wife would see, I think things are going through because they are liking my profile. All of the things that I have done during Spain during these uncertainty times are the things that they are very much looking for in my. So I think we needed to do that to do the jump. That was my patient there. And then I had the privilege in speaking to them, in cross-checking, seeing the hospitals, and having all of that process through. And then when I did finally decided to go with my Mediclinic, I think was the best decision that I made. I also received another call from another hospital after that. So I was like, what has happened? And I think it was a very special way to do it. And looking back at it, I was like, I think we made the right choice in every aspect in life. So it's been quite a journey to go through. Yeah. But I came here with I think I have topped my academic part of my specialty over there, and now we have a way to develop something new, something different, something unique.
What was your PhD on? Sorry,
it's a PhD in drug allergies. I did it's in medicine, my PhD, and I did it specifically for called drug allergy management in complicated severe cases. And that's the idea. So I did studies with patients with myeloma, with allergy to their medication. Then I did with patients with rheumatoid arthritis with biologic treatment, rituximab, and also with patients with mastocytosis. And so I did a story how to manage and treat and control people from diagnosis until we can do desensitization processes. So my main thing that I did in Spain was desensitization to drug allergy. So we did I did my PhD in that scenario, and also PhDs in allergies. Not that many have the opportunity to do it. So it was very, very surprising. And when I did my dissertation, when I did my defense of the PhD, my one of the boards that was there to see me was the head of department of gastroenterology. And I thought, yeah, but gastro is, I don't know, he has the background to understand what I'm going to do in the defense, but still I did my defense and everything. And when I finished, one of the things that he praised me for was I'm a gastro. I understood everything that you explained, and I want my patients. I want to refer you my patients for you to do those types of things because I find it fascinating.
Wow.
It was like, oh, so I got through gastro, so it was like so that means that I did something with PhD. So and they awarded me the cum laude for that, so it was a good thing. So, and I love giving dissertations, lectures, things like that, and try to do them as interactive as possible to try to people understand, and not to give a lot of facts here for them to understand. So I got my PhD there in drug allergies, and I did it was from one of the university called Alcalá de Henares University. It's a very old and very, very famous university over there. And then I had to do the graduation ceremony. They put on the gowns and everything like that. It was very, very, very interesting to see that, and they streamed it online, and all my residents were like, oh, you were with the hat and things like that. I was like, yeah, don't see me like that. And they were very happy that they put a picture of my PhD in the wall from the resident in Spain. I'm still there in their wall. like I think so. Yeah, those are very, very difficult. I started my PhD like in 2018, I think it was. I had that 2-year problem with COVID. Then I restarted 2021, and I managed to finish it 2024 ends, and I defended in 2025. So it was like
Perfect.
Yeah, it was all the time. I was like that. So yeah.
Look how that's probably going to be able to help, contribute to your practice here.
Yes, that's right.
UAE.
Yeah. It was telling me, you have a PhD? Yes, I have a PhD. So not a lot have a PhD. No, I know. And you do classes. I love giving lectures. Right? That's one of the things that I like a lot, to give my knowledge, pass it on to someone, for them to have the tools to do that. And I saw that here with my first lecture that I gave. They invited me to do a lecture like a month after coming here to Mediclinic. That I like at the Mediclinic. Every Tuesday they have a CME type of lecture with a lot of so there was, I didn't know anyone, almost like a couple of them that I eat with them and had lunch. And I finished the lecture. There were a lot of questions, and people were like, oh, you can do that. So that's part of your, so we have to focus on this, focus on that. It was like, so I have opened a little bit there. And after that also, I was a lot of referrals from them, and a lot of patients. And then also with my patients, I do that. I'm a doctor that I like to explain them everything. And that background that I have with PhDs and everything gives me the tools to do that. So I have a lot of information for them. So I gladly tell my patients, when you leave my clinic, you're going to be more smart about your pathology and why we treat it. And they like that a lot from that point. And some of them, they tell me, oh yeah. One patient I remember like 2 months ago told me, is this the lecture that you gave to the colleagues? And it was, yeah, how do you know that? Oh, it's because my friend is from the emergency department and told me that he was blown away by one of your presentation that you gave. So now I know why he told that. I was like, oh, thank you very much. So it is I told my wife, if later down the life things go through, I will love to be a professor. University type of things, because I think I enjoy a lot of that. That's why I take my time with patients and everything to explain them all of that. And so I did practically enjoyed my journey through PhD world, and that has opened a lot of possibilities, and also has unlocked a part of my character, part of my way to explain things to patients. And I will have transmitted that part to my colleagues that have been that I have formed during my years in Spain, and then they very much are very grateful for that scenario. So yes. So tough to do a PhD, but I encourage, if anyone needs to do it, I think it could be something important. You will learn a lot of yourself during that time. Yes.
Really inspiring. So do you do regular talks in the hospital?
We do it every Tuesday. They have they invite someone from each specialty to give lectures.
Yes.
To type of networking that we have over there, and also to learn from other specialties, things that they do, what you can recommend for, and I think it's a very nice way to keep the hospital doctors engaged.
Yes.
And to know each other, and to see how we refer things like that. So it's very, very, very interesting for me to go through that route as a big type of not only for that department but to all of specialties. So I've been learning a lot from them also. So they did dermatology. They do also medical legal things to know about. So they prepare you for a lot of things, and I think it's very important to have that scenario, that aspects also. And I have been invited for that lecture, and now in February I'm giving a lecture in Abu Dhabi in the Congress, the 5th annual Congress of Allergy there. So they have invited me over there.
When is that?
It's in February in Abu Dhabi. Yeah, so I'm going to talk for drug allergy in pediatric patients. So interesting topic. So be there. Yeah.
And they've got quite a big rheumatology department in Mediclinic as well, isn't it?
Yes.
So that's quite relevant.
Yeah, very big. We have a lot of autoimmune, inflammatory diseases that we can overlap a lot.
Yeah.
So it's a very important thing for me to have a good rheumatology department for me to be referring patients to, and then also in hematology is one of the other that we have also contact with. One of the things that I liked about allergy and immunology when I did my training was a specialty that had a lot to do with a lot of other specialties. So for example, you have asthma, then you have relationship with pulmonology, you have relationship with dermatology, you have relationship with rheumatology, you have relationship with hematology, gastro, oncology, so in infectious diseases, for example. So while I was doing my training in Spain, they called you from all those specialties to see patients. So it was like, you had a networking of people that you have to learn about. So and it was very inspiring. And now that I'm a consultant, you see that formation, you need to have those specialties to back you to know, because there's a lot of overlap, especially in immunology department, because most of the inflammatory autoimmune disease have to do with immune system. So that's why having that background, that backup helps you a lot.
Yes.
And that's why I think in Mediclinic for me has been the best place to go through. Because of that package and that doctors that they have, the specialties that they have high guarded specialties and specialists there. So I'm learning from them a lot. So yes, I think it's a very nice network to be there, to be in. So yeah, very, very, very
perfect fit.
Perfect fit. Yes, I think so. Yeah, like a glove.